shall do. But please, please, please feel free, any one of you, to say to me, hey, Dr. Kaz, are you recording the session? Because I would hate to have a really awesome session and not record it for you folks to go back and look at later on, okay? All right, I'm gonna keep drinking. Oh, well, thank you, Gracie, I appreciate that. Very considerate. All right, sharing is caring, and that's what we're going to be doing here. We're going to be sharing information about stuff. Okay, so let me pull up. Let's pull this up here. Boom. Booyah. Okay, here we go. So let's talk a little bit about physiology. All right, so we talked about anatomy. As you guys know, form and function, not form and function, but form and structure is anatomy. Okay, so let's talk about function. Let's talk about physiology. We're going to learn about how things work. All right, and the thing you want to understand is a lot of physiology is based off of how things work at the molecular and cellular level. So some of you might be shaking your head like right now, like, oh God, no, you know, I don't like chemistry or biochemistry, or you know, or anything that has to do with things that I can't see. I'm going to tell you this right now. First of all, chapter 2 is the biochemistry chapter, okay? And I hope you guys feel comfortable knowing that I am going to teach you that chapter, and I failed chemistry in high school. Yeah, I guess that's the best that Greenville Tech could do. We're going to hire this guy that failed chemistry in high school, and then we're going to ask him to teach it to our students. Don't worry about it. I have come a long way with chemistry, okay? I took it again in summer school, got a B in it, then got straight A's in college, and then I took organic chemistry too. So if you folks really want to hate yourself and put yourself through some torture, take organic chemistry, all right, and then come talk to me. We're not going to go into great detail, all right, for chemistry, so you don't have to worry. I'm not going to ask you how many carbons or how many electrons carbon has, or you know, how many shells does argon have? It's not going to get into all that, okay? So, but if, and a lot of what we're going to be talking about for physiology, all right, the functions of certain tissues and systems, we break it down to the molecular and cellular level. One is because we've learned more about, you know, how these processes work. And so if you get a good foundation in this course, all right, a good foundation in biology 210, all right, it's going to help you in biology 211. The strongest part of a building in a house is the foundation. So we're going to lay that brickwork, all right, and it's really important because you'll hear me, and I teach both 210 and 211. I'm not doing 211 this semester, but I've taught it in the past. And so many times in 211, I've caught myself saying, you know, you learned this back in 210, and some students will stare at me, you know, with a blank stare, a blank expression on their face, and I'm like, you just did not realize the importance of it at the time. So I want to impress upon you that this is something that's very important that you learn, all right, these basics now, because then the rest of the course, and even in 211, it'll be much easier for you, okay? So I won't go through all of these, but you can figure it out here. When you know, when we talk about cardiovascular physiology, we're talking about the heart and all the related structures that have to do with the heart. All right, so blood vessels. All right, and then what travels inside the blood vessels? The blood. Okay. Neurophysiology, we will be talking about that this semester. Cardiovascular physiology is in 211. All right, so neurophysiology has to do with nerves in the nervous system. So we're going to talk about that. All right, respiratory phys is in 211. Reproductive phys is in 211. Pathophysiology, we touch on some of that in some of the chapters. All right, but we're not going to get into a lot of detail about pathophysiology, and only because there's another course for that, all right, in which they get into much more detail. All right, so we'll see what happens and to the body's function when it's in a state of disease or if it's injured. Okay. All right. So keep in mind, form, which is anatomy, and function, which is physiology. These are interrelated. One has to do with the other. So that's why we teach them both together. Okay. So because both rely on information of the other discipline. All right. So that's why it's become for as long as I can remember now, we've integrated the two courses. So why do we need to know that? Why do we care? Well, I know why we care, but why do we have to combine them? All right. So let's look at, all right, the function of the alveoli. The alveoli are the air sacs in your lungs. Okay, and this is where gas exchange occurs. All right. Your respiratory gases are oxygen and carbon dioxide. All right, and it's important that you understand the anatomy of that, all right, to understand how it functions. So what I mean by that is the walls of the alveoli, all right, are tiny, not tiny, are thin, okay? They're one cell layer thick, okay? That's the thinnest that you can get, all right? And that's ideal because when you have oxygen and carbon dioxide trying to cross a barrier, do you think it's easier for one molecule of oxygen to travel through a cell membrane that is one cell thick or 50 cell layers thick? Feel free to type your answer in. Is it one? Is it easier for it to go through one, or is it easier for it to go through 50? So far, so good. Yeah, you're darn right. So, okay, so you don't even have to be a scientist. You guys have just sitting here with me for almost 2 hours, all right? You are smart enough to figure out just by common sense that it's easier for that molecule to go through. Well, that's the anatomy, all right? The alveoli are one cell layer thick, made up of squamous cells, all right? And we'll talk about that when we get to tissues, all right? But your lungs are made up of thousands of, or each lobe has thousands of alveoli, which means it has a relatively large surface area, which means that the gas exchange, the carbon dioxide and the oxygen that travels across those walls there, between those cells, all right, you can get a large amount of oxygen and carbon dioxide exchange occurring because we have a large surface area. Point being is you understand that relationship between anatomy and physiology. All right, and so we'll talk about that throughout the course. And so that's why with me in this course, I will explain several of these concepts to hopefully where if you just have to think, not too much, but yeah, you should be thinking because that's an active learning process, all right, that you'll understand, you'll gain that thorough knowledge, all right, of these structures here, all right, then you can understand how they function, okay? So that's why we teach them together, so we can understand how they function. So you heard me mention earlier that there's a level, there's an organization level, there's levels to organization, all right? So with Bio 210 and 211, we start with the simplest, and that's what you're going to do with me, and then we'll progress to the more complex. So as we move to the bottom of this page, we go from the simplest level of complexity, the chemical level, to the most complex, which is the organism as a whole, the organismal level. Okay? So in chapter 2, we'll study the chemical level. In chapter 4, we study the cellular level. In chapter 5, we study the tissue level. Okay? And then, from that point on, then we start to cover the skin. And the skin is an organ. So we'll start to do the organ level. And then we'll start to do the organ system levels, like the nervous system, the muscular system, and so on and so forth. All right? So we start with the simplest one, the chemical level, basic atoms and molecules. And then we start to group them together, and they form cells. All right, and then we start to group a bunch of cells together that are similar and they perform a common function. Now we have a tissue. And then we take a bunch of different tissues, all right? They don't have to be the same, they can be different, and they can perform not just one function, but many functions. We throw them all together, all right? And we get an organ. And then we place a whole bunch of related organs that work together for a common purpose, and then we get the organ system level, all right? So that's what we're doing. We're going to go from the simplest to the more complex or the most complex. All right, we talk about the levels of organization here. All right, so let's start off with this, our first very important concept. And this concept pretty much is the umbrella, all right, that all the other chapters will fall under, okay? Because ideally, all right, your body wants to be in a state of homeostasis. So what is homeostasis? All right, I'm going to read off the definitions. The ability of an organism to maintain consistent internal environment in response to changing internal and external conditions. So what the heck does that mean? What that means is, all right, that you can have a chaotic external environment that you're in. Crazy stuff could be going on in the room around you. All right, and your body is going to do its best to make sure that all of its functions are operating normally, healthy, appropriately, all right, and consistently, all right? So when you're in a state of homeostasis, you're healthy. But when you fall out of a state of homeostasis, all right, when things start to go haywire, all right, diarrhea, for example, when we're talking about the GI tract, all right, that is a state of disease, all right, not disease, but disease. Something's going on, something's disrupted. Your internal environment is no longer consistent, all right, because of something that has occurred. And so you're no longer in a state of homeostasis. When you have a fever, you spike a fever. Your temperature is no longer at that optimal level, that consistent level, okay? So you have several hundreds of different physiological processes and anatomic structures that are constantly being monitored by your body, all right, that constantly have to make alterations to things that are going to challenge your state of health or your state of homeostasis. Okay, so we're going to talk a little bit about what that is. All right, so to understand homeostasis, you got to understand what makes up the homeostatic system. There's three components to it, okay? So make sure that you understand the three components, all right? You have the receptor, the control center, and the effector. Okay, so let's start off with the receptor. The receptor is going to be the structure that detects changes, all right, both inside the body and outside the body. So you got receptors that monitor what's going on in the room around you, right? And you also have receptors that are monitoring what's going on inside your body. So an example of an internal receptor would be when you eat a whole pizza and you fill your stomach up and your stomach starts to stretch out, you have stretch receptors in the stomach that signal to your brain, hey man, stop eating. I'm full. Knock it off. Stop being a glutton. And so you get that feeling of being full. Those are the internal receptors there. Okay, you also have receptors that monitor what's going on externally, like the thermal receptors in your skin. They monitor how hot or cold the room is, your car, outside. Okay, so they detect any changes that are going to occur. So in order for a receptor to detect something, you need what's called a stimulus. Okay, a stimulus. And it's the stimulus, it's going to be something that is going to create that receptor to be activated. Okay? So an example is a change in the temperature in the room that your skin senses. Right? If the room gets really hot because the air conditioning just broke. All right? That's the stimulus, that broken air conditioner, that increase in temperature. The thermoreceptors in your skin are going to detect that change. And what that will do then is then, hey, these receptors have this information. Hey, it's hot in this room. I need to tell somebody. So it's going to go and tell the control center. So it's going to send this information, or the input, right? It's going to send that information to the control center, because ideally, all right, your body wants to affect some sort of change, right? Like, hey, it's hot in this room, I need to cool down, okay? Now I can either leave the room, or my body can undergo some changes, or it can try to make some alterations to cool itself off, okay? So that's what the control center is for. The control center receives that input, that information from the receptors, right, telling it what's going on. Then the control center is going to initiate some sort of change. It's going to think it over. It's going to figure out, all right, what am I going to do? How am I going to fix the problem? And then it's going to go ahead and fix the problem. So there's two control center aspects. One is the nervous system. The other is the endocrine system. We're going to learn about the nervous system this semester. The nervous system operates on an electrical current, all right, which is called a nerve impulse. All right, we'll learn about it. It's called an action potential. Anyways, think of it as like an electrical charge or whatever, okay? Well, anyways, it's going to provide a quick response. The endocrine system is based on a chemical response, so it takes a little bit of time. So it's going to be a slower response, but its response, I can't talk tonight. Its response is going to be sustained. It's going to last longer, okay? So the examples here you can see with the nervous system, regulation of the blood pressure upon rising. So if I'm sitting in this chair and I stand up quickly, I get a head rush. Whoa, I get a little bit dizzy, lightheaded. Whoa, 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 whoa. Well, that's because my body's undergoing changes in blood pressure, okay? And so it needs to do it quickly, because if it doesn't do it quick enough, I'm going to pass out, okay? But with the endocrine system, you might have low blood calcium levels, right? It's called hypocalcemia. And if you're hypocalcemic, that means your calcium levels in your blood are low, and your body realizes that. And so it's like, oh man, I've got to increase my blood calcium levels. So I've got to go get some calcium from somewhere. Well, where can I get it from? Well, it can prevent your kidneys from excreting calcium, or it can cause your bones, which is where we store some calcium. We break the bones down a little bit, and we release calcium from the bones. Well, anyways, you've got the parathyroid hormone that's going to help in regulating your calcium levels. It's been a while. Can you remind me what the different responses are called? Breathing versus... Heather, you know what? I'm not really quite sure what you mean. Like breathing versus speaking, the different responses to a stimulus? That I'm not quite sure about. Well, to be honest with you, I'm not quite sure what the question is. If you want to give me a little bit more of a detail. Okay, yeah. All right, no worries. All right, so finally, the control center decides what its response is going to do, and then it needs somebody to do the heavy lifting. It needs something to bring about the response, and we call those effectors. And an effector is going to be the structure that's going to bring about the response to the stimulus. And in this case, the effectors are going to be either a muscle or a gland. Okay, so we're going to go through some examples, and I'm going to kind of explain to you how this system works. So to go into a little bit more detail, let's start off when we talk about a response for the homeostatic system here. We refer to that as a feedback loop. So we need a stimulus first. Okay, so check. That was the increase in temperature. Okay. The increase in temperature is detected by the receptor, the thermoreceptors. So that's another check. All right. So now we have the receptor that's detected that stimulus. And so that receptor is now going to transmit that information to the control center. There's another check. We're going to relay that information to the control center. Now the control center is going to take that information, and it's going to kind of figure out what to do with it. So it analyzes it and figures out, okay, I need to cool things down, right? So it's going to send a message to the effectors. Check. And the effectors are going to bring about that change. And because of that, when they bring about that change, it's going to return us back to homeostasis. All right, let me see what these questions are. Is the feedback loop the same as a reflex arc? Similar. All right, that's a great question. We'll talk about that in chapter 14. Okay, very, very similar, but a feedback loop because it does require a stimulus, and you can just plug in. All right, the receptor is going to be our stress receptor that gets transmitted through the sensory neuron to the control center, which is going to be the spinal cord, part of the central nervous system. And then that spinal cord is going to initiate a response through the motor neuron back to the effector, which is going to be skeletal muscle, like the knee jerk response when they tap your knee. So the feedback loop is very similar to the reflex arc. Very good thinking. Does Heather mean autonomic versus voluntary? Okay, so I see what you're going with this. Yes, yes, yes. Okay, so different responses. Yes, you'll have an autonomic or what we call a somatic, which is voluntary. Okay, sorry that I didn't understand what you were talking about. Great job on that, Tara, for helping us out here. Yes, so you will have, and we'll talk again, great input there, because we will talk about these responses when we get to the nervous system. But the autonomic nervous system is going to be something that is going to be subconscious. You won't be aware of the changes that are occurring. For example, are you aware when your heart rate goes from 65 beats a minute to 69 beats a minute? Do you tell your heart, okay, go from 65 beats a minute to 69 beats a minute? No, you don't. All right, that's an autonomic response. Voluntary responses, all right, or voluntary response is going to be, hey, it's cold in this room, I'm going to put a jacket on. All right. So autonomic, and we're going to talk about that. So we're going to talk about the autonomic responses and voluntary responses later on in the semester. All right, but keep it good thinking. Good, you're pulling this stuff together. All right. So here's basically this slide here is this slide here is the words. Now we'll put it into a picture. So here's your stimulus, your receptor, your control center, and your effector. All right. So the stimulus, all right, is going to be we're too low on something. Okay. Actually, you guys probably can't see that very well. No problem. Oops, wrong way. All right, so in this case, all right, you have your temperature drops down. All right, your body temperature, for whatever reason, drops down. All right, because it's cold somewhere. Okay, in fact, you know what? I'm going to show you that here in a second, so I'm not even going to use that example. But basically, what we're seeing is you have a stimulus. Okay, the receptor detects whatever that stimulus is. It transmits that information here to the control center. Control center will then integrate it and process that information, and then it's going to decide how it wants to respond, all right, to whatever that stimulus is. And it sends that response information to the effector to bring about, all right, the change that's required to bring homeostasis back, to bring the body or whatever it is back into homeostasis here, okay? So I'll give you some examples here. All right, first, all right, when we're talking about regulation of homeostasis or the homeostatic systems, there's two ways we can regulate homeostatic systems. One is through the negative feedback loop. The other one is through positive feedback. So let's talk about the negative feedback. The negative feedback loop is the one that's more commonly used by the body, okay? But you want to think of the negative feedback loop, all right, as essentially, all right, your body's going to want to set up a specific well, a range, but we call it the set point. And the set point, for example, we'll use body temperature. What is the normal body temperature for a healthy individual? Anybody happen to know? That's right, 98.6. So that 98.6 is going to be our set point. So ideally, your body wants to stay at 98.6. So according to our diagram, that's our set point right there. Okay? So what will happen is, though, things happen. You start to exercise, your body temperature goes up. Okay? And sometimes your body temperature goes down. Right? So if our body temperature starts to rise, it can go up to 99.1. And sometimes it can drop down. Okay? And it can go to 96.4. That is your normal body range, by the way, for body temperature. That range right there. Anything above 99.1 is usually considered to be like a low-grade fever, all right? But that's the normal range, 99.1 to 96.4, okay? And 98.6 happens to be that set point that sits right in the middle. So you can see, according to our graph here, all right, your body temperature can fluctuate, all right, in between 99.1 and 96.4, right through here. So when we start to fluctuate, all right, either above our set point or below our set point, your body is going to try to always bring it back to the set point. So if our body temperature drops down and it cools off, if we're going to use the negative feedback, all right, the resulting action, all right, is always going to be in the opposite direction of the stimulus, okay? So what that means is, if our body starts to cool down, your body's going to do some, it's going to try to bring about some sort of change that warms it up, and vice versa. If your body becomes too hot, then it's going to try to bring about some sort of change to cool it down, okay? So when we're talking about negative feedback, it's always in the opposite direction of whatever that stimulus is going to be. So here's a picture that illustrates that. Okay, and I'll walk through it with you a little bit. All right, so here we got this guy sitting here on a bucket doing some ice fishing. So it's cold outside, okay? So his body temperature starts to decrease. It starts to approach 96.4, okay? So he has these thermal receptors in his skin, and they detect that cold temperature, okay? So they send that information to the brain, to the control center, okay? Specifically, in this example, our control center is the hypothalamus, because the hypothalamus is a structure in your central nervous system, in your brain, okay? Specifically the diencephalon, that is responsible for temperature regulation. So the hypothalamus detects this, all right, and says, all right, there's some input coming in, and it's saying it's too cold. I need to warm the body up. So I am going to now cause a couple things to occur. How do we warm the body up? Right? One, we undergo what's called vasoconstriction in the blood vessels of our skin. And what that means is we make the blood vessels in the skin really small. Okay? We shrink them down so less blood can flow into the skin. And that directs, all right, the blood into our core. And it keeps it away from the surface of our skin, because if it's close to the surface of the skin, blood is usually 1 degree warmer, all right, than our normal body temperature. So if it's near the surface of the skin, the heat in our blood will then leave the body. Well, we don't want that. Okay, that'll cool us off even faster. So we want to keep blood closer to our core. Plus, our organs need that. They need the blood, all right? So they're selfish. So that's one thing that happens, all right? Another thing happens is that your skeletal muscles start to contract and relax quickly. That's called shivering. And as they contract and relax quickly, you start to create friction. Friction generates heat. And the third thing that occurs to warm our body up is, you've ever heard of goose flesh or goose pimples? Okay? Well, if you look close enough here in our drawing, oops, all right, you've got these muscles here that are at the base of your hair follicle, and they contract, and it causes these bumps to occur on your skin, but it causes your hair to trap heat against your skin. So those are the three things that will occur that will help to increase, all right, your body temperature, thus going from too low now back to homeostasis. Okay? So that's a negative feedback mechanism. All right, let's use another example. All right, we got Chopper McChopperson here out in this sun. He's deciding to chop this log. All right, so it's hot outside. Your body temperature starts to increase. All right, your thermal receptors sense that. All right, there's a lot of heat hitting your skin. Okay, plus you're working out. So that the sensory receptors in your skin send that information again to the control center, which is the hypothalamus, because it's in charge of body temperature. Sends it to the hypothalamus, says, hey, it's hot out here. Things are getting hot. We need to cool down. The hypothalamus is like, all right, let me cool down the body here. Here's what I'm going to do. Okay? So what happens? The blood vessels undergo what we call vasodilation. They get big. Okay? They blow up. So more blood can come to the surface of your skin. And that blood brings its heat with it, so heat can leave the body. And not only that, what do you do when it's really hot? What does your body do when you walk outside and it's 95 degrees out and you have to walk? That's darn right, it sweats. Yep. You start to sweat. And so as that sweat occurs, all right, and it gets to the surface of your skin, it evaporates. And that process of evaporation causes a cooling effect. And so all of that, all right, decreases the heat, all right, and it allows your body to go from being too hot back to homeostasis. So that's another example, all right, of homeostasis. All right. So who was it? Alexia was asking about the feedback loop and the reflex arc. Yep, the withdrawal reflex, all right, involves a feedback arc, all right, specifically that negative feedback. So we'll talk about that back when we do chapter 14. We'll talk about that, all right. We won't really talk about it in this semester, okay. Goosebumps seem counterintuitive. I know. You know, it's so funny you say that, Heather. They do seem counterintuitive. Because when you look at it, you know, you wouldn't think that it's going to trap the heat, all right, and that it would increase the surface area. I agree with you, but for whatever reason, you know, it is a heat-saving reaction that occurs. And it's funny. I'm glad I'm not the only one that thought that, because I kept thinking to myself whenever I was learning this, it was like, am I the only one that thinks like this? That doesn't get it? Am I missing something? Good to know I'm not alone. All right, so when we talk about heart rate and blood pressure, you'll learn more about that in 211. Same with the breathing response. We'll talk about parathyroid hormone, what happens and how it reacts to that hypocalcemia when you have the decreased blood calcium levels when we do chapter 7 for the bone. All right, and then obviously with insulin by the pancreas, when you have increased blood glucose or blood sugar levels, it'll increase your insulin release. And of course, when you increase the insulin release, it's released into the blood, it decreases your blood glucose levels. And again, you'll learn about that, all right, in 211. All right, so all this stuff is exciting. You'll learn it. All right, so we talked about one of the systems or one of the loops that regulates that helps to regulate homeostasis. The other one is positive feedback. This is less frequent. Okay, your body doesn't use this as much, right? But what happens is, all right, the reaction or the results of the positive feedback loop will always be in the same direction as the stimulus, okay? So in order to get you back to homeostasis, all right, it's going to be in the same direction, all right? So here are the 3 examples that we have: breastfeeding, labor, and blood clotting. All right, I got a picture here for the breastfeeding one. Okay, so here's an example. So here's mom nursing the baby, all right? The baby's suckling at mom's breast, and mom has receptors around the nipple that will stimulate, whoops, all right, that will stimulate the receptors, all right, that will send information to the control center, again, to the hypothalamus. And it will say, all right, baby is suckling at the breast. We need breast milk, okay? So at this point, because mom's already had the baby, she's already producing prolactin. That is the hormone that produces breast milk. But we have to find a way to get that breast milk out of the breast, okay? So this is where our hypothalamus comes into play. The hypothalamus sends a message to the pituitary. Here's the hypothalamus. You can barely see the pituitary. It's down here. It sends a message to the pituitary to release oxytocin. Oxytocin is a hormone, all right, that stimulates the breast to eject the milk out, all right, as the baby is feeding. So as long as the baby is there and suckling on the breast, that will stimulate the receptors that will release the breast milk, okay? But when the baby gets older and starts to move onto more solid foods, they'll nurse less frequently. And when they start to decrease, all right, that frequency of feeding, mom starts to produce less breast milk. For those of you that are moms and have experienced this, you know what I'm talking about then. You have actually been a part of the positive feedback loop, okay? All right, this is a very important slide here. So keep that in mind. If you want to understand, all right, the homeostasis and some of its characteristics, this is a great summary slide here. So one, all right, homeostasis is always changing, okay? The control center is made up of two systems, the nervous system and the endocrine system. One uses chemicals and the other one uses electrical current or an electrical signal, okay? There's three components to the homeostatic system: the receptor, the control center, the effector. All right, most homeostasis is regulated through negative feedback. All right, and when these feedback systems don't work anymore, all right, then we have a problem and we're out of balance. All right, so we get into a homeostatic imbalance, and then you can have disease, which ain't good. Okay. So we talked about this. So these ranges here, these homeostatic variables, all right, here's our set point, all right, but we have that range of 99.1 to 96.4, all right, that's that range that we want to keep the homeostatic variables inside of, all right, blood glucose levels, blood pressure, all right. Does anyone happen to know what the range for blood pressure is? What's the lowest that blood pressure can be for normal? I'll tell you. Well, that's average. So on average, yes, Blair, 120 over 80 is going to be like the average. 70, you're close. So we're going to use the two numbers. The top numbers, this is the systolic. The bottom one is the diastolic. So the lowest that the blood pressure can be is going to be 90 over 60. And the highest that normal blood pressure can be is 140 over 90. All right? So that's your range there. Okay, so this is the lowest that it can be, 90 over 60. And this is the highest. So if it's above 140 over 90, then you have hypertension. Okay, and if it's below 90 over 60, then you have hypotension. Okay, does anyone have an idea of what can cause really low blood pressure? That's right, that's what I was thinking. I wonder if that makes me a morbid person. Yeah, blood loss. You know, you're in a car accident, you sever an artery, you start to bleed out, your blood pressure drops. If your heart is not beating as fast, if you have if your heart rate decreases, your blood pressure drops. All right. If the resistance in your circulatory system decreases, your blood pressure drops. Iron levels wouldn't affect it so much. Well, all right. Possibly. And this is what I mean. If you have low iron levels, your body is then going to try to get more iron in circulation. How does it do that? And again, now we're jumping to 211, but I don't mind mentioning this. Close to death, I would. Oh, okay, yeah. So yeah, I wouldn't be surprised. Yeah, they have really low blood pressures in hospice. Well, Casey, God bless you. I couldn't do hospice. Hospice is tough. It's tough. But if your iron levels are low and iron travels in your red blood cells, then your body's like, you know what? If iron levels are low, I want to get more iron into circulation. I'm just going to put more red blood cells into circulation. So when you put more red blood cells into circulation, okay, then you can make your blood more thick, more viscous. And that can increase your blood pressure. That can cause an issue there. But a lot of times what will happen too is some of the red blood cells that you make are immature and they don't function appropriately. You get to learn all that stuff in 211. See, it's exciting times, exciting times. All right, so when we talk about these ranges, especially when we're talking about clinical practice, all right, this 80 to 100 for blood glucose, or this 90 over 60 to 140 over 90. These are what we refer to as the ranges, all right, for clinical health, okay? And this determines what we consider to be healthy individuals. So if your blood pressure falls within this range, then you're considered, hey, you're a healthy individual. If your blood glucose falls within this range, you're considered to be a healthy individual. Same with temperature, all right? So for the majority of us, all right, how did we get these ranges? Well, what happened was we just started taking a big sample from people that we considered to be healthy, all right? And out of that certain percentage, 95% of those individuals that we sampled, that's how we established these ranges here. So now we consider those to be the normal range. If you fall outside that range, then you're considered to be unhealthy. But a small percentage of healthy people, about 5%, will fall outside that range, but they're still considered to be healthy. So what happens when you fall out of one of those ranges? Okay, now you're in that homeostatic imbalance, or you're diseased. All right, you have a disease. Well, diabetes is a perfect example. Right, insulin helps to take our blood sugar. All right, it helps to take glucose out of our blood and put it into our tissues. Okay, it does a couple other things too. Okay, so when your blood glucose levels start to rise, all right, insulin increases. Well, guess what? If you're a type 1 diabetic, you're not producing that insulin. All right, and so what happens to your blood glucose levels? If you don't have insulin, all right, and insulin decreases your blood glucose levels, what is your blood glucose levels going to be? Yeah, that's right, they spike. They're going to stay high. No, they're not going to drop. They're not going to drop because insulin causes the blood glucose levels to drop. Okay, so and again, you'll learn this in chapter 17 in 211. So when you eat a meal, okay, say you eat McDonald's or pizza, there's a lot of carbohydrates in pizza. Okay, so glucose is in carbohydrates. So your blood glucose levels, as you start to digest the pizza, will increase. Well, that will stimulate your pancreas to release insulin, okay? And then that insulin will take all that glucose that's floating around in your blood, and it's going to put some of that glucose into your liver. It's going to put some glucose into your skeletal muscles. And it'll start to put it into, and it sends a lot to the nervous system, to the central nervous system, because your brain loves glucose. So when it does all that, your blood glucose levels drop. Okay? That's the normal procedure. Well, when you don't have the insulin to do that, think of insulin, IN. Insulin puts glucose into things, into the cells. Okay? Well, if you don't have that insulin, it can't put the glucose into the cells. So your blood glucose levels will remain high. Okay? So that's one example of what happens when things don't function properly, when we fall into that homeostatic imbalance there, all right? So is there such a thing as producing too much insulin? Oh, of course, yeah, definitely. And if you produce too much insulin, then what will happen is, all right, your blood glucose levels will drop. And when they drop bad, or horribly, you can go into shock, diabetic coma, a couple things, right? So as a healthcare professional, whether it doesn't matter what field you're in, if you're treating patients, you're going to have a patient that could come in with a problem, and you got to figure out what that problem is. And when we figure out what that problem is, we call that a diagnosis. All right? And for a lot of times, what will happen is when patients have a problem, they are no longer in homeostasis, they have a homeostatic imbalance. Okay? So we're going to try to figure out what that problem is by formulating a diagnosis. And I'll tell you in a second how we get to that diagnosis. But when we want to treat that diagnosis, we use several different things. Some of that can be medications, right? And medications can help get us back into homeostasis. So when we're trying to figure out how to diagnose somebody, we're going to use the scientific method. See, there was a method to my madness about bringing up the scientific method. Okay, so a patient comes in, and you want to figure out what's wrong. There's a reason why they come in there to see you. Like when I have a patient come into my office, I walk out to the waiting room, and I go and greet them, and I bring them back into my office. As soon as I see them, I'm observing them. I'm looking at them. I'm seeing if they're pale. I'm seeing, you know, if their eyes are bloodshot, if they have bad breath, all these different things. If they're coming to me with a cane, or if they're having a walker, or if they're in a wheelchair, right? So basically what I'm doing is I'm observing them, okay? So you can gather a lot of information by observing them. So then I sit them down, and I'm like, all right, tell me what's wrong. And so they'll start to tell me their problems. What's going on? What's happened? You know, I can't sleep at night, all right? I have this pain shooting down my leg. So as they're telling me that, I am gathering data, okay? And I can start to, with that data, I can ask them more questions. Then after that, then I'll say, all right, well, let me examine you. Let me do some, a quick examination. Let me look you over. We'll do some reflexes on you, some muscles. We'll do some orthopedic and neurological tests. So we'll take some vital signs. We'll check your height, your weight, all right, your blood pressure, all that stuff. Okay, so all that I'm gathering data. So then I start to formulate what's called a DDX, and that stands for Differential Diagnosis List, which is essentially a hypothesis. So I'm coming up with a list, a number of things that could be wrong with this person. This person can have diabetes. This person can have a disc herniation, and I just go through and try to figure out what's wrong with them. And I come up with a long list of a differential diagnosis, which is my hypothesis. And then I'm like, well, then I need to order more tests. So maybe I'll order some x-rays or an MRI, and that gives me more information. And then I can cross things off of my list, or I can add things to my list. All right? So I'm able to either modify my diagnosis, my differential diagnosis list. I could confirm certain possible diagnoses, or I could just reject it and say, that's it. And at the end of it, I'll finally come up with my diagnosis. So now I got to figure out how to treat this patient. Well, what about drugs? What happens if a patient comes into me and they're depressed? Okay? So I'm like, okay, we can prescribe to you, all right, some antidepressants. Well, there's a certain classification of antidepressants. They're called SSRIs. That stands for Selective Serotonin Reuptake Inhibitor. And basically what we find out is people that have depression, not everybody, but most, will have low levels of serotonin, which is a neurotransmitter. A neurotransmitter allows one neuron cell to communicate to another neuron cell. Okay? We find out that they have low levels of serotonin. Well, now I got to figure out a way to increase their serotonin in their brains. One way to do it is to give them this drug that blocks the reuptake of serotonin in between the nerve cells. Because that's what happens. The serotonin gets released by one neuron, and it affects the second neuron. But then after a while, that serotonin gets absorbed back up into the first neuron. Well, guess what? I have an idea. I want to keep that serotonin out there longer so those two nerve cells can communicate more. and communicate longer. So I'm going to make a drug that blocks those nerve cells from absorbing that serotonin back up. And that's what I do. And so we've created this class of drugs called SSRIs. And by doing that, I've increased the serotonin in their brains. And that then helps to decrease their depression by elevating their mood. Pretty cool, huh? All right, and this picture here is just some of the different medical imaging that we use. X-ray, CT, ultrasound. All right, that's it for the lecture. And I know I took some time in lab. I'm going to start some lab material here. Not much, but I wanted to finish up the lecture information. Chapter 1 is a very important chapter, but it's also the easiest chapter. All right, so I'm going to urge you to really, really study that when you have the opportunity to, okay? Because a lot of our foundation is based on that. If you have your lab atlas, bust it out. Take out your lab atlas. We're going to do just some labeling right now. All right, now these first couple of slides aren't going to be in your lab atlas. All right, but you can look at them in your book. This first picture it's crucial. You need to know, excuse me, before I continue, are there any questions about what I was talking about? And I have to tell you guys, I'm really enjoying myself in this class right now. All right. That could be good, that could be bad, because I can go off and talk, but I really want to teach this information to you as much as I can. If there's a situation in which I'm moving along and talking and whatnot, and being from upstate New York, sometimes I can talk a little bit fast. If you want to slow me down, just raise your hand if you're here in class and ask me a question, okay? That allows me to slow things down so you can catch up a little bit, okay? All right, so this first picture here is the anatomical position. And you need to be familiar with the anatomical position, because you're going to hear me say anatomical, when we're looking at certain slides, I'll say, well, this slide is in the anatomical position. Because what we're seeing is this person is facing us. So if you're looking at your screen right now, where I'm drawing this arrow, that is you and I, that's our right side. Okay? And this is our left side. Okay? As we're looking, I'm talking about you and I. This is my right side, this is my left side because I'm looking at the screen. But when we're talking about the anatomical position, all right, we're going to reference and use this person as the point of reference. So this, where I'm drawing this is the person's left side, and this is the anatomical right side of this person. Okay? So when I am talking about certain things, we're always going to put it in reference to the anatomical position of whatever we're looking at. Not your left or right, but the model's left and right, okay? So you see what I'm saying? This is this person's left, and this is this person's right. That's what you need to understand about the anatomical position. So the anatomical position visualizes here, this model is facing us with the palms facing forward, okay, and the feet flat on the ground. That is the anatomical position, okay? So we got a couple other positions. Now we're going to take this person and we're going to lay them on their face. Boom. Okay? This is the prone position. So when you go on the floor to do push-ups, you're in the prone position. When you sleep on your stomach, you're in the prone position. Here's the prone position. Now we're going to flip this person over onto their back. That's the supine position. I tell folks how you remember what the supine position is. The supine position is you're laying on your spine, feeling fine. Okay? That is the supine position. You need to know these positions. Okay? Anatomical, prone, and supine. Now, those are the positions. Let's talk about the planes. So, we have these planes in which we use to divide the body into different parts. Okay? So the coronal or the frontal plane is going to divide the body into front and back parts. Okay? So you can see this big blue plane, right, is dividing the body. Here's the front, here's the back. Or this is the anterior position, not position, excuse me, the anterior part. Anterior is another way of saying front. And posterior is another way for saying back. Okay? So I'm drawing the arrow. This is the anterior. All right. So again, the coronal or frontal plane divides the body into anterior and posterior parts. Now, we're going to divide the body into upper and lower segments, or superior and inferior segments. So the transverse plane, much like to where the magicians used to saw the lady in half back in the day, okay, that's what the transverse or cross-sectional plane does. It's going to saw the body in half, all right, top, all right, and bottom halves. Or superior, all right, superior and inferior halves. Okay? So the superior, superior is the top portion, inferior is the bottom portion. See that? Cool? All right, and then you have the mid-sagittal plane. Pay attention to this. Mid-sagittal, M, middle. It's dividing this model right down the middle into equal right and left halves. Mid-sagittal divides the body into equal left and right halves. Not to be confused with the sagittal plane. You can see now with the sagittal plane, we moved our little blue line over. And it doesn't divide the body equally into equal right and left halves. Okay, so keep that in mind. Don't confuse sagittal plane with mid-sagittal plane. And then finally, oblique. The oblique plane travels through the body. It can be at a 45-degree angle. It can be at a 60-degree angle, 70-degree angle. All right? But it's just some sort of plane that comes through the body, all right, at some sort of odd angle. That's the oblique plane. All right, here's a picture showing all the planes, all right, and how you can use some of our visual imaging here. Okay. All right. I'm not going to go through the medical terms with you. I'm leaving that up to you. There are figures in Chapter 1, okay, which explain some of these medical terms. We don't have the time for me to go through it. It used to be the medical terminology used to be a prerequisite class for this course. It is no longer. What is the opposite of supine? Supine is laying on the back, so the opposite of supine is prone. Is there a left and right sagittal? Well, I mean, you'll have left and right halves from a sagittal plane. But when we're talking about the sagittal plane, all right, that plane could be more towards the right or more towards the left. Yeah, parasagittal is going to be off. Yeah, it's going to be, yeah, parasagittal is off. It's not, yeah, it's either mid-sagittal, which is right in the middle, or sagittal plane, which is going to be more to one side. Parasagittal includes that. So these pictures here, all right, whoops. You're going to want to be familiar with these, okay? So what they're showing you here, all right, the arrow's pointing to the front, so that's anterior. This arrow's pointing to the back, that's posterior. Going up towards the head is superior, down towards the feet is inferior. Medial and lateral, All right, medial thick midline. Draw a line down the center of the body. Okay, anything that's towards the center of the body is going to be medial. If it's out towards the side of the body, that's lateral. Okay, proximal is going to be close to the midline here. Distal is going to be a distance. It's going to be further away from the midline or the axial skeleton. Okay, but again, I want you to have to go through your book and go over this stuff. Whoops. There we go. All right, so this table here shows you, all right, these terms and the meanings for them. So you're going to need to be familiar with these terms. So I would suggest that you go into, this is from the second edition, but you're going to want to check these terms out, all right, in your textbook. It's in chapter 1, all right? You just don't have the time. Now, I'm going to tell you something right now. This picture here, in this picture here, we use the same ones on our lab test. And you're probably going to have 2 or 3 questions that are going to show this picture, and you'll have, all right, a line going to a specific part, and you'll need to name it. And if it's pointing to the back part of the arm here, you'll either have to call that the brachial, or you can call it the arm. Okay? This part of the spine here, all right? So again, memorize this. Look this figure over and this figure over, because you're going to have lab questions on that. All right, let's talk about the abdominal pelvic regions. There's 9 of them. If you've ever played tic-tac-toe, all right, it uses a similar type. This is a way that we can, what we do, we've taken the abdominal pelvic cavity and we've partitioned it off into these different compartments here. So the one, X marks the spot in the center, that's the umbilical region. Okay, so we name it after your belly button, the umbilicus. Okay, so directly above that, right, we have the gastric region. Right, that's above the umbilical region. But what means above? Gastric has to do with the stomach. Well, here's the stomach. Okay, and a majority of this region is above the stomach, so we call it the epigastric region. The hypogastric region means below the stomach. Well, obviously, this is well below the stomach. But the hypogastric region is below the umbilical region. Okay, right through here. All right? So here we can see you have your right and your left hypochondriac regions. Now, we're not talking about a person that thinks that they have every single disease that's known to man. Okay, yes, that's a hypochondriac, but this is hypochondriac. Okay, the chondriac, that portion of the term has to do with the cartilage here, the rib cartilages. Okay, and it's below the majority of the rib cartilage. That's why we call it hypo. So this is on the left side. And again, this is the anatomical left, our right. All right. So you have left hypochondriac region and the left hypochondriac region and the right hypochondriac region. Below the chondriac regions, we have the lumbar regions. Well, if you think about it, these lumbar regions have to do with the lumbar spine. That's your low back. Okay, where your ribs stop. All right, on your spine. Okay, down to your hips. You have 5 vertebrae there in your spine. They don't have ribs that attach to them. That's the lumbar spine. All right, that's where you're going to find these regions here. All right, and then finally, the last 2 regions are the right iliac region and the left iliac region. Okay, those have to do with your hip bone. Another name for a portion of the hip bone is called the ilium. So we call it the right iliac region and the left iliac region. All right, so this is one way to map out the abdominal pelvic area. Another way to do it is just to bust it up into what we call the quadrants. So all we've done, I like this system, it's pretty easy, but it's a lot more general. Okay, so you can see we've just got a vertical line and 1 horizontal line. It divides up the abdominal pelvic region into 4 quadrants. And it's self-explanatory. Left upper, right lower, left lower. Okay, real simple. All right, let's do a little bit of labeling. Give me 10 more minutes and then we'll call it quits. if you have your lab atlas, all right, bust it out. If not, not to worry, because you can always go back and watch this recording, okay? The nice thing about it when you watch the recording is that you can go back and pause it, all right, and write stuff down. All right, so thyroid cartilage. All right, this blue structure right here, this is, some people refer to it as the Adam's apple. That's the thyroid cartilage. It's on the anterior portion of your neck. It's made up of hyaline cartilage. You have 3 types of cartilage. We'll talk about it. 3 types of cartilage, but hyaline cartilage is when it's stained, it normally appears blue. Okay? Right below the thyroid cartilage is your thyroid gland, right here. All right? Keep that in mind. You want to know where one structure is in relation to the other. Okay, so the thyroid cartilage is superior to the thyroid gland, or the thyroid gland is inferior to the thyroid cartilage. For any of you that's ever had their thyroid gland palpated and checked, right, that physician or nurse practitioner or physician's assistant needs to know where the thyroid gland is in relation to the thyroid cartilage, because a lot of times they'll use the thyroid cartilage as a landmark. Okay, trachea, that's your windpipe. Don't call it the windpipe though. Trachea has these blue rings around it. Again, these blue rings are made of hyaline cartilage, but it's these blue rings that help to keep the trachea from collapsing in on itself. Okay, that's the trachea. Here's your thyroid cartilage. Here is part of your thyroid gland. All right, your trachea then divides, all right, into your right and left primary bronchus, okay? So your right primary bronchus goes off to the right side here, and your left goes off to the left, right? Now, if you look, you'll notice that the right primary bronchus is more vertical, while the left is more horizontal, right? You can see how this one kind of dives down, and this one kind of dives down, but it goes out. That's why if somebody inhales something and it gets stuck and it travels down into the trachea here, it's more likely to get lodged in the right primary bronchus compared to the left, because it's more vertical. It'll tumble down in here. Okay? Just an FYI. So that's the right primary bronchus. There's the left primary bronchus. Okay? Spelling does count. And you need to tell me that it's the left versus the right. If you put in left or right, you're better off. Okay? All right. Here's the right lung. Easy so far, right? Right lung, left lung. All right? Be specific. You tell me, yes, it's a lung, but I need to know, is it the right lung or left lung? It's kind of important, especially after you give medical orders for somebody. Hey, you've got cancer in the left lung. Don't you think it's important that I need to be specific on which lung I need to have removed? I can't just say remove the lung. All right, if the cancer's in the left lung, I need to be specific. I need you to be specific. Tell me, all right, left or right lung. All right. So let me ask you something. Perspective is very important. If you see this picture, now you already know what it is, all right? Oh, come on. If I were to just put this on the lab test and say, what is that thing? Do you think that we can take notes? Yes, you can take notes in the atlas. That's your atlas. You do with it as you wish. I would definitely take notes in the atlas. Make it worth your while. So if you see this on a lab test and it says, what is that? I mean, if you were paying attention when I first put the slide up, you know what it is. But at first you don't know what that is. My point being is, and this is what I want you to understand, when you look at these slides and you're taking the test, don't just focus in at whatever the arrow is pointing at, all right? Don't just do that every single time. You want to see the whole thing so you kind of get a perspective, okay? So you can see that this structure is attaching the head down to the stomach, right? And the only structure that does that is going to be the esophagus, right? So if you're not sure, zoom out and look at the whole picture, and that might give you some perspective as to what you're looking at there. All right, so what we've done here now is we've removed the heart, okay? We've taken out the heart, right? And you've got this arrow pointing at this tannish, pinkish thing, right? A couple things you want to understand. So is the reason the left bronchus is more horizontal because the left lung is further out? When you mean further out, like further away from the midline? Well, yeah. Yes, because the left bronchus is a little bit longer too because it's also having to contend with the heart there too. So you have to understand the heart sits, right? In the right lung, you have 3 lobes. All right, in the left lung, you technically have 3 lobes, all right, but mainly just 2 lobes. And the heart kind of presses on, and because of the positioning of the heart, the left bronchus is going to be more horizontal because, yes, to answer your question, Jonathan, it does kind of push it out. It's further away from the midline there. Great question. One of the things I want you to understand in this class that colors will help you to differentiate certain structures from one another. So what I mean by that is, when we talk about tubes, if you've got a blue tube and you got a red tube, if you see a red tube, at least for this class, for 210, it's most likely going to be an artery. If you see a blue tube, it's most likely going to be a vein. Well, this color structure, all right, is neither of those things. Yes, correct. Oxygenated is red. Deoxygenated is blue. Correct. So we know it's not a blood vessel, okay? And it's too big to be a nerve, all right? So what else is in this area? It doesn't look like a bone. It's the esophagus. So I want you guys to start thinking of these things. That's not what I want. That's what. All right, here's the heart. You can see it nestled in between the 2 lungs. It's more towards the left side here. And here's the heart all by itself. 211, you'll learn all these different structures. But for this class, you just need to be able to identify the organ. I think that's fair. Here's your breathing muscle, your diaphragm. Sits right underneath your lungs and the heart. Actually, the heart sits right here on top of the diaphragm. Okay? So here you can see the diaphragm, right? And it's one of the structures that we use to divide the thoracic cavity from the abdominal pelvic cavity. So everything above the diaphragm is going to be in the thoracic cavity. Everything below the diaphragm is going to be in the abdominal pelvic cavity. All right, we're going to stop here. And actually, you guys are all caught up to the other section, so I'm not going to proceed any further. Please look at your course schedule regularly. Read my announcements. It's a good way to know if you're on top of things, okay? Is there any questions right now? I know I threw a lot out at you. The next class, we're going to be just jumping right into teaching. Okay, and I might have to answer a couple questions. But anything that comes to mind right now. If not, do you know if we can just print the ebook instead of buying? Printing that out. You know what? I don't think that McGraw-Hill will allow you to print that off of their website. And I'm not sure, but I don't know what the price is for printing out all those pages and whatnot. It might be more expensive printing that. I could be wrong though, but I am not sure. But again, it depends on what your preference is. Loose leaf, I used to use my textbooks as my notebook. I would write my notes in the margins there. But it really it's a preference.